A chronic cough is a difficult problem sometimes. It has to do with the fact that cough is a symptom, meaning that it's a series of problems that people have for which there may be many causes. Most often it represents the problem of the lower airways, so the lungs, and specifically the bronchial tubes inside the lungs. And when they become inflamed, cough is a symptom that one gets in order to clear that inflammation. If you have pneumonia, then you have infection going on in your lungs. In the case of asthma, it's inflammation. That inflammation is genetically determined, but may be triggered by a variety of different factors, including infection and allergens and other events going on. So it's a manifestation of airway inflammation. However, sometimes it's more complex than that. People can have a cough because they have allergies, and they're having upper airway inflammation with drainage and secretions that lead to mucus accumulating in the lower airways. Sometimes the cough is due to heartburn or reflux or acid contents coming from the stomach up into the back of the pharynx and then being aspirated or inhaled down into their lungs. And so the source of their cough is really their GI tract and acid problems. Sometimes it's sinus infections, and they get chronic sinusitis and are chronically draining and seeding the lower airways with infectious organisms. And so cough is a symptom for which there may be many different sources and causes, and that's largely what we do, is to sort through the symptoms and the findings and the signs to try and identify the specific source. Many times, especially for people who've had a cough a long time, it can be more than one thing at a time. Our focus for therapy then really centers on what the reason is for their cough. If it's lower respiratory, gastrointestinal, nasal pharyngeal, allergy, sinusitis, whatever the case may be. Our treatment depends on what we find is the reason for their cough.